Everyone experiences anxiety. The butterflies in your stomach before a presentation at school, the tension you feel in a job confrontation, and the way your heart pounds when you're in danger. Anxiety is a perfectly normal and often helpful feeling. It prepares you for action and readies you to respond to a threatening situation. When anxiety becomes excessive, it may fall under the category of an anxiety disorder. The intensity and frequency of anxiety determines if it is normal or abnormal. Anxiety disorders leave you unable to cope with life due to abnormal fears. It causes overwhelming fear and sleep deprivation. There are many different types of anxiety disorders, such as panic disorder, obsessive-compulsive disorder, post-traumatic stress disorder, and generalized anxiety disorder. All anxiety disorders have the same types of symptoms. The symptoms include constant worrying, frequent nightmares, obsessions about danger, irritability, restlessness, heart palpitations, fatigue, high blood pressure, sweating, dizziness, nausea, vomiting, and shakiness. There is no way to cure an anxiety disorder. However, there are ways to control it. The two main things used to control anxiety disorders are medications and psychotherapy. The medicines normally used are selective serotonin reuptake inhibitors. They alter the levels of the neurotransmitter serotonin in the brain, which helps the brain cells communicate with one another. Another type of medicine used is a benzodiazepine. Benzodiazepines enhance the action of the neurotransmitter gamma-aminobutyric acid, which calms you down. In addition to medication, people suffering from anxiety disorders often go to psychotherapy. Psychotherapy involves talking with a trained mental health professional to discover what caused the anxiety disorder and how to deal with its symptoms. The combined amount of people affected by anxiety disorders is approximately 40 million people, which is 18% of the U.S. population. Anxiety disorders are the most common mental illness in the United States. They are highly treatable, yet only 30% of those suffering receive proper care and treatment. Women are twice as likely to be affected by these disorders than men. The average age of onset of these disorders is 31 years old. However, the greatest amount of people with the disorder are ages 45 to 59, which is 7% of the U.S. population. The majority of famous people suffer from some type of anxiety disorder due to their demanding jobs and constant press. Howie Mandel is one celebrity that suffers from an anxiety disorder. Mandel is a comedian and former host for the popular game show Deal or No Deal. Mandel suffers from obsessive-compulsive disorder. He has always had a phobia of germs, which prevents him from shaking hands or hugging others. A fear of germs doesn't necessarily mean you have obsessive-compulsive disorder, but Howie Mandel's lifestyle changes are indicative of a person that is overcoming a real mental health disorder. Howie Mandel not only doesn't shake hands or touch dirty things, he even keeps his hair shaved to help him feel cleaner. LeAnn Rimes is a famous singer with an anxiety disorder. The name of her disorder was not released. However, in 2012, she entered a treatment facility for severe anxiety and stress. Her representative stated that she simply needs to relearn coping tools for the significant anxiety that comes with being a celebrity. David Beckham became a famous soccer player, but is now famous for many more things. He suffers from obsessive-compulsive disorder. David Beckham's obsession is order, specifically with pairs. He needs to have even numbers with everything or he becomes very uncomfortable. He has been known to throw out or add things in order to make sure they're an even number. Anxiety disorders are displayed in many ways in movies, TV shows, and books. The movie Analyze This has a portrayal of mixed anxiety and depression and a delayed onset of post-traumatic stress disorder. The movie also demonstrates how to be an unethical psychologist. The movie Captain Newman, M.D. is about a military psychologist during World War II. It uses an interesting portrayal of post-traumatic stress disorder and its treatment. Rick Nauert, Ph.D., wrote the article, Better Diagnosis of Anxiety Could Improve Care for Veterans. This article states that many war veterans don't get the proper care and treatment they need after war. Most veterans are automatically diagnosed with post-traumatic stress disorder after they came from war. However, a lot suffer from other things such as generalized anxiety disorder, obsessive-compulsive disorder, or even a non-specified disorder. Primary care providers only detect 50% of patients with mental health problems. Psychologists are currently working on being more diligent and do screening early so the proper care can be offered. In my survey, I asked 5 girls and 5 boys 5 questions about anxiety disorders. The questions were general knowledge questions regarding anxiety disorders in general. I thought it would be interesting to see which gender got more correct. The results were about equal. However, the lowest scoring person was a girl with 0 questions correct, and the highest scoring person was a boy with all 5 questions correct.